Rosiglitazone is a thiazolidinedione indicated as an adjunct to diet and exercise to maintain glycemic control in type 2 diabetes. In this video, let's find found. What is rosiglitazone? What is rosiglitazone used for? Contraindication. What are the side effects of taking rosiglitazone? How does rosiglitazone work? How to use rosiglitazone? What is rosiglitazone? Rosiglitazone, trade name Avandia, is an antidiabetic drug in the thiazolidinedione class. It works as an insulin sensitizer by binding to the PPAR in fat cells and making the cells more responsive to insulin. It is marketed by the pharmaceutical company GlaxoSmithKline, GSK, as a standalone drug or for use in combination with metformin or with glympyride. First released in 1999, annual sales peaked at approximately $2.5 billion in 2006. In Europe, the European Medicines Agency, EMA, recommended in September 2010 that the drug be suspended because the benefits no longer outweighed the risks. What is rosiglitazone used for? Rosiglitazone is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus. Contraindication. Contraindications to rosiglitazone include patients with active liver disease, hypersensitivity, type 1 diabetes mellitus, diabetic ketoacidosis, and hyperosmolar hyperglycemic state. Side effects: abdominal or stomach pain, chest pain or discomfort, decrease in the amount of urine, flushed, dry skin, fruit-like breath odor, increased hunger, increased thirst, increased urination. Pharmacodynamic. When rosiglitazone is used as monotherapy, it is associated with increases in total cholesterol, LDL, and HDL. It is also associated with decreases in free fatty acids. Increases in LDL occurred primarily during the first 1 to 2 months of therapy with Avandia, and LDL levels remained elevated above baseline throughout the trials. In contrast, HDL continued to rise over time. As a result, the LDL/HDL ratio peaked after 2 months of therapy and then appeared to decrease over time. Mechanism of action. Rosiglitazone acts as a highly selective and potent agonist at peroxisome proliferator activated receptors, PPAR, in target tissues for insulin action such as adipose tissue, skeletal muscle, and liver. Activation of PPAR gamma receptors regulates the transcription of insulin-responsive genes involved in the control of glucose production, transport, and utilization. In this way, rosiglitazone enhances tissue sensitivity to insulin. Half-life: 3 to 4 hours, single oral dose, independent of dose. Dose: type 2 diabetes mellitus. Initial 4 mg p.o.q. day or divided q12hr. If inadequate response A for 8 to 12 weeks, may increase dose to 8 mg p.o.q. day or divided q12hr. Monitor: alt at start of treatment, q month for 12 months, then q3 months thereafter. Safety advice. Advice and warnings for the use of rosiglitazone Avandia during pregnancy. FDA pregnancy category C risk cannot be ruled out. That's all the information about rosiglitazone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.